Welcome everyone to the Health Policy and Management video. Today we'll be speaking about only health policy. Now let us understand what is health policy. Thereby we will extrapolate the discussions towards the health management. So yes, policy and management. What is policies? Policies are nothing but which is vividly expressed in a whole series of practice, statements, regulation, even laws which are the result of decisions about how we will be doing things. This was stated in 1996 by Barker. Policy is an empirical record of the past, not just the ethereal goals of the future, as in Walkman 1986 stated it. So policies can be laws, it can be documents, it can be procedures, it can be the guiding principles, working framework, and rules and regulation. Yes, this is what we are looking as far as policies are concerned. Laws, document, procedures, guiding principles, working framework, rules and regulation. Policies as intent, the intentions of the policy, that is the written goals, written objective, the vision we are talking about, and the plans to develop activities. This is the policy as intent. What are the attributes of a policy? Now, there are three attributes. One is commitment, status, and belongingness. We're talking about commitment, status, and belongingness. Let us start with belongingness. To whom the policy belongs to? Is it the property of the government or the institute that is executing the policy, or the organization that is engulfing the policies, or the department that is responsible for the policies? Policies is equally responsible for everybody. It is for the society to decide upon it. So yes, these are the executive arms of the government as far as institute, organization, department, and government itself is concerned. The commitment and status. Remember the stated intention. This need to be stated in black and white, absolutely clear. There cannot be any confusion. Should I say there cannot be any gray areas? Desire to make things happen. Status is defined by backing of certain influential entity per se. So yes, we are talking about the stated intention, desire to make things happen, and the status as defined by someone in political powers or in the power corridor. So policies as a practice, policies as it actually experienced, or probably when as understood by the common people, the public. It comprises of routine decisions about a policy thereby. Types of policies, there are numerous ways through which we can divide a policy into different types. It can be normative, it can be empirical, it can be proactive, it can be reactive, it can be substantive or administrative, it can be vertical or horizontal. So there are numerous ways in which we divide policies. Normative versus empirical, proactive versus reactive, substantive versus administrative, and vertical versus horizontal. So types of policy. Let us go for the types of policy. What are we looking at is there are basically three types of policies. We are talking about the normative policies. What is normative policies? It is it asserts and assesses the preferred objectives and goals, as in the prioritize. The normal things is the goals, the goal number one, goal number two, goal number three, normative policy. Empirical policies is it monitors the practice of the present and records of the past, as in what have you done in the past and how are you going processing as of today's, as of present. Then is the substantive policy. It is concerned with legislation. It is concerned with programs, the practices that govern the substantial aspect of community work. So normative is goal oriented, one, two, three, four, five. Empirical is what we are doing as of today and what we have done in past. And substantive is how to go across with it, how to execute the policies as in the program, as in the practices that governs the community work. So then we have something called administrative policies. Now these are involved in collection of statistical information, the data points that we keep on collecting, and the evaluation of the complex community program. Remember, the data points might not be making much of a sense, but once you arrange the data points, filter it out, screen it out, you will make some good, valuable information. And that is what the administrative work is all about. It administrative work is to get or to basically record data. Reactive. Now, what is it? It emerges as a concern of a crisis that might be addressed, as in an event has occurred which is detrimental, and now you are going to react to it. You are going to take steps so as to make the things in proper order as normally expected. Then is something called proactive. Before the event or any disastrous or any detrimental thing happen, can you take proper steps to regulate the policies to ensure that the program is going smoothly and as planned? So proactive are introduced and pursued through deliberate choice per se. And then we have a vertical or a horizontal, as the case might be. So what are we looking at? Vertical is developed within the organization that is responsible for implementation, top down or bottom up. Horizontal, it is created with between the parts of an organization and among the organizational components that are similar in hierarchical position. This is very true, that needs to be understood time and again. So, health policies refers, now we are coming to the health policies. Health policy refers to the decisions, to the plans, to the action that are undertaken to achieve specific health goals within the society. It outlines the priorities and expected roles of different groups. It builds consensus and informs people. This is what WHO, the World Health Organization, has stated it. Again, health policy refers to the decision, plans, and action that are undertaken to achieve specific healthcare goals within a society. It outlines priorities, it outlines the expected role of the different groups, and probably also builds consensus and informs people. So, health policy may be used as a regulatory tool that calls on the government to prescribe and to control the behavior of a particular target group by monitoring the group, imposing sanction if it fails to comply. This is what the regulatory health policy would be looking at it. Examples of regulatory policies include prohibitions of smoking in public places. Altogether, examples. So, what are we looking at in terms of allocative health policy? Allocative health policy involves the direct provisions of income, direct provisions of services, direct provisions of good to a certain group of individuals or institution, as in the affected group, as in the deprived group. Now, if you are looking into it, if you can administer certain things, medical insurgencies, medical interventions, let's say about diphtheria, let's say about polio, these are the vaccines that needs to be taken, given to the poorest of the poor of the society, because either they are not aware of it or they simply don't have the means to do avail it. Examples include funding of a medical research, provisions of public health and health promotion services, as I've already said about diphtheria and polio per se. So that is what allocative health policy would always be all about. Policy planning cycle, situation analysis is what we are looking into it. Priorities, goals, and objective settings. Option appraisals, programming, implementations, and monitoring, evaluations thereby. These are the things that you need to keep an eye upon it. What is happening and how do we proceed as and when it is happening around there. These are the things that needs to be having a proper feel of things per se. So engaging stakeholders, the government as a policy regulator, the companies, the organization as a policy implementer or approver altogether, and the individual who is supposedly seeking the policy. What are we looking? These are the stakeholders that are majorly there, predominantly there. We are talking about government, non-governmental organization, community groups, society, civil society organizations, business and the private sector, political parties, local government, donors and aid agencies, including global health initiatives, United Nations agencies, including World Health Organization, healthcare provider network, patient and health service users, as the case might be. This is what we are looking forward to. The engaging of the stakeholders and at different level, both vertical and horizontal, be it governmental, be it political parties, be it local government, be it donors, be it civil society organization, you name it, and we have it. Situation analysis is the social determinants of health and the health needs. Expectation include the current and the projected demand. Health system performances or and of performances gap thereof. Capacity of health sector to respond to the current and to the anticipated future challenges. Remember, health system resources include human, physical, financial, and informational roles altogether. Yes, we should always keep in mind about the stakeholders' position. So that is what the situation analysis would looking into it. Now bringing all together is comprehensive, coherent, balanced national health policies, national health strategies, and probably national health plans per se. Different differences between health policy of developed and developed countries do exist. Obviously, yes. Global agencies have the major responsibility to assist in aligning the program planning refers to the national health policies and strategies and plans. Remember, between developed and developing countries, there are differences about health policies just because their infrastructure level is different altogether at a different level, different scale, and that is what we need to take into consideration. So, as a country, definitely we should be having a national plan. Should we have between developed and developing? We should at least try to arrive at a benchmark position. And yes, everybody is a stakeholder, irrespective of which country, which continent you are located in. Everybody should be trying to have a program planning on a national health policy, from vision to operation. Effective planning at various level of a health system is essential for ensuring alignment between people's need, people's expectation, and overall national priorities. The extent of the linkage between policies, practices depends on the level of detail in the national strategic plan and degree of decentralized autonomy at other levels. Costing resources, quantifying needed inputs in terms of people, equipment, infrastructure, time, training, and then determining the budgetary implication. Health sector stakeholders must provide realistic input at all times. With this, I come to an end of this video. Thank you for watching it.